Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to do a modified knots test. You will need your anticoagulated blood, purple top, formalin, a white top tube, pipette, new methylene blue stain, gloves, and then your slides and things like that. So let's get into why we do this. So the reason why we do a modified knots test is to identify microflaria, but there are two specific kinds. So you have diroflaria immitis, that is from mosquitoes, that is heartworm disease, or you have dipetitolinema reconditum. Sorry, I don't say that often. And being able to tell the difference between the two. And identify those versus just a normal blood smear. So when you're doing this, by adding the formalin, centrifuging it, adding the stain, it makes those parasites pop up a little easier. It also lyses the red blood cells, so things don't get lost in there like a normal blood smear or just that heartworm drop test. So with that, typically, if you do see diroflaria, you're going to see them in larger numbers. Everything that you will see is going to be stagnant versus in a typical heartworm smear where you're not doing this, things will be moving. These are just going to be stagnant. Their body is typically thicker and darker than the dipetitolinema reconditum. They're going to be darker. Their head is going to taper towards the end, and I kind of like to think of them as like a strand of hair. If you've ever seen hair under a microscope, that's kind of how they look. Dipetitolinema reconditum is typically lighter. Their body's a little thinner, not as thick as the diroflaria. The head doesn't taper; it's pretty blunt or squared off. It has a hooked tail, and that is actually spread by fleas. So two modes of getting into the body, completely different scenarios, both concerning. However, if it's diroflaria immitis, you're looking at heartworm, which could be life-threatening, and that's the main concern. For this portion, we did dilute 10% formalin because we did not have 2%, but we have 10%. We made that dilution, and we are going to add 3 mLs of this into our white top tube and 0.3 of this into that mixture as well. So wearing gloves, of course, because formalin is a carcinogen. These calculations solely based off the fact that we only have 3 ml tubes. There's that. Carefully capping that, and I do have a bag here to dispose of that syringe. Okay, so with my anticoagulated blood, I'm going to collect 0.3 mils. Great. And I'm putting it into that white top tube to mix with the formalin. So now I'm going to gently invert this a couple times to mix the blood with the formalin. I'm going to centrifuge it for 5 minutes at 1,000 to 1,500 RPMs. And then we'll go into the next step. Okay, so now I have the 2 tubes that I will use to balance each other out to place it in the centrifuge. And then we will come back in 5 minutes. So after some recalculation, because we had our dilutions wrong, we had to remake the solution. But now that it's out of the centrifuge, I'm going to decant it. So your clear fluid that's sitting on top of your blood clot at the bottom, you're going to want to remove all that gently, careful not to disturb your bottom cells. That way you can add in that drop of methylene blue after. Okay, so I have my jar of methylene blue, and what I'm going to do is take my pipette and place one drop into just the cells. The rest back. And then I'm going to use the same pipette to mix everything up. So you should be left with something kind of like this, very dark. And then now what you're going to do, same pipette, you're going to take a drop from your sample, place it onto a clean microscope slide, which I have right here, and then take a look under the microscope with a cover slip. So as you can see, there's my one drop of blood, and placing that cover slip on. Okay, so now that I have my slide on the microscope, I'm going to look at it at 100 times magnification and 400 times in a zigzag motion. I'm going to do that generally gross examination, looking at everything first, and then as I get a closer look, try to identify and see if I see any of the microfluria that we're looking for. Alright, so I did not see anything, which is good. The microfluria check on this with the modified NOTS test would be considered. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating a direct fecal test for Clinical Pathology 2 Fall Semester 2024. This is something that requires minimal equipment. It is a fast scan to look for parasite eggs in various stages. So commonly protozoal like Giardia, trophozoites, eggs, cysts, things like that. It can be done in almost any setting because it requires minimal equipment, gloves, feces, wooden applicator tips, sterile saline, microscope slide, cover slip, and your microscope. And again, it's just a fairly fast scan, not always accurate though. All right, so I've got my sterile saline here. What I'm gonna do is put 1 to 2 drops on the microscope slide. And now I'm going to take the wooden end of my applicator stick and only get a very small amount of feces to mix in that sterile saline. There's not an exact measurement, but you want a very small amount. And so now I'm just gonna swirl it in there. Enough so that I've got debris on here, but I don't want any big chunks because that could obscure my view. But it should be thin enough that you can read newspaper print through it. Otherwise it's too thick and it won't be as accurate. So mixing this and removing any big debris items. Okay, I'm going to throw this away. What we're going to do is we're going to take our cover slip here and just place it on top of the mixture. Okay, so now that I have my mixture with my cover slip on, it should look something like that. You want to be able to breathe through it, but know that there is fecal matter on there with no big pieces of debris. So now I'm going to take a look at it under the microscope with the sample side up. And you're going to start, look at it on 100 times and 400 times. So your 10 and your 40. And again, I'm going to be looking for cysts, eggs, trophozoites, protozoa agents like Giardia could potentially show up on here. There's other debris that you could see too, especially, after sitting in the grass, you could see just foreign bodies in here, which is why it's not always reliable. Some people do like to add a drop of methylene blue to their stain, not required. All right, so now that I've got it into focus here, starting on that 100 times, I'm going to scan pretty much the whole slide and do a quick scan. Right now, I'm just seeing lots of debris, pieces of leaves, grass, dirt. Nothing too concerning. Now, this dog is on prevention, however, that doesn't mean that they could not end up with intestinal parasites. All right, moving on to 400 to take a closer look. I'm gonna have to go back one. I'm not seeing any cysts, eggs, larvae. Nothing concerning on this fecal. I would say I've looked at it pretty thoroughly, and it would be a negative fecal direct smear. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to do a fecal float for Clinical Pathology 2 Fall Semester 2024. The reason why we do this, typically it's routine to check a fecal. Common in puppies and kittens to have some form of GI parasitosis. The other thing is if we're experiencing GI symptoms, right, loose stool, upset stomach, diarrhea, constipation, things like that, anything imbalanced, we want to check a fecal and make sure there's no parasites that could be causing those symptoms, so to rule it out. The purpose of this test is to easily identify ova of parasites more easily due to their specific gravity. So it allows them to float to the top and identify them more easily. Most ova of parasites are going to have a specific gravity of 1010 to 1020 grams per milliliter. So that's what we'll be looking for and why we do that. You will need 2 to 5 grams of feces. There are various types of fecal solutions. You can use magnesium sulfate, zinc sulfate, the sugar water combo, the salt water combo. Today I will be using fecal float solution, which is zinc sulfate, and using that. Okay, so now that I've mixed it well enough that it looks like this, I'm going to take the fecal loop out. And it looks like a pretty even mixture. I have my gauze here. I'm going to place it over my clean, empty tube. And I'm going to slowly pour this in so that it filters out large particles. Okay, so I'm going to fill this up the rest of the way with my Fecasol. Okay, so now I've got that little dome there. I'm going to take my cover slip and very carefully place it on the top. Now that's going to sit for 10 to 20 minutes, so I'm going to do 15 and start the timer. Okay, so starting on 10 times and going up to 40, so 100 and 400. I'm going to be looking for nematode larvae, eggs, cysts, things like Trichuris vulpus, Toxoplasma gondii. Those are what your type of nematodes you're going to see in a fecal float. So
She's good to check out.
No, or gotta get the correction.
Are they in the invoice?
That one.
So on the simple float, I'm not seeing anything too concerning. A lot of artifact or debris, dirt, or seeds from the grass. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating and completing how to complete a centrifugal fecal examination. So you're going to do the same steps as a float, but you're going to centrifuge it. The goal is to recover more eggs and cysts in a less amount of time. This is a more sensitive test. It requires the same amount of 2 to 5 grams of feces. And then mixing it, so we'll get right into that. Okay, adding my 30 mils of fecal salt. Again, the line is marked. Taking my clean fecal loop and stirring until it's an even consistency, and it's considered an emulsion. So with even consistency, I want it to be the same all the way around. As I said earlier, for the type of solution that I would be using today, I am using zinc sulfate, and I know I forgot to mention that. When we centrifuge this, we want to do about 5 minutes, typically at 400 to 650 Gs. What I'm going to do is I'm going to filter it into a clean tube, and then taking that, just what's left in the clean one, I'm gonna dump that into this white top tube to then centrifuge it. Okay, since the centrifuge and the sediment can be centrifuged at the same time and then speed, I'm gonna, since they're about the same and balancing each other out, I'm going to spin them at the same time. So I've got my centrifuge sample here. Now I need to add more Ficasol to the top until I get that meniscus again, and then I need to place a cover slip and let it sit for about 15 minutes. And then we will wait 15 minutes and evaluate. Okay, so now that my centrifuge fecal has been sitting with that cover slip for 15 minutes, I'm going to take it and place it onto my blank microscope slide. For my centrifuge test, because it was centrifuged, it's going to make everything more sensitive and hopefully float to the top to be able to identify more nematode, ova, larva, cysts, eggs that you couldn't see on just the typical fecal float. So starting on 100 times power and then moving up to 400, taking a gross examination of everything and then looking at a closer look. Okay, so again, for my centrifuge sample, I'm not seeing anything. This was a freshly collected sample. It didn't sit on the ground long. It was refrigerated until it was time for it to be made up into slides. So all of these fecal tests are negative, which is a good thing. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to do a fecal sedimentation and read that for Clinical Pathology 2 Fall Semester 2024. This is typically done in large animals where you're suspecting parasites that produce ova that are too large to be recovered with a standard flotation, and that most commonly you're going to see fluke ova, which is why we do this for that. In this, you need a very small amount of feces, 2 grams. We're going to add just a little bit of water to make that nice emulsion, and then we're going to filter it into a clean tube and then pour it into a centrifugal tube. Going to centrifuge it at 400 Gs for about 5 minutes, or you could create that meniscus and let it sit for 20 to 30 minutes. For this purpose, I'm going to be centrifuging it. And then we'll have to carefully, after we get that, there will be 3 layers, and I'll show you that. We're gonna have to discard or decant the supernatant off the top with a pipette. We're gonna take a sample from every layer and place it on a microscope slide and look at it at 100 times magnification once we're done. Got my 2-gram fecal sample here. I have got my H2O, and I'm just going to add a little bit. Less than what we've been using with the Fecasol. Okay. And I'm still going to stir to create that even consistency throughout the emulsion. Okay, now that that's pretty consistent, I'm going to take my gauze. I'm going to place it over the top here again, straining it into that clean tube. To filter out any large particles. Okay, so now that we have that to be centrifuged, we will put it in a tube that is able to be centrifuged. Still able to put the cap back on. We're gonna centrifuge, I think I already said, at 400 Gs for 5 minutes. For my sedimentation one, I need to carefully decant all of the supernatant here. There are 3 layers, and I will need to collect a sample from each, place 1 drop onto the microscope slide, and then evaluate those again under 100 power and 400 power. I'm decanting. Okay, so using a different pipette because I really don't want to cross-contaminate each time, I'm going to start with my first layer. Place a drop. I'm going to go to my middle layer. Place a drop. And lastly, my 3rd layer. And this is because fluke, ova like to settle. They don't float to the top. They're heavier, and so that's why we do that. And then now I'll place a cover slip on each one of them. Apparently it lives in the next building over from them. And just be sure to label front, middle, last, or however 1, 2, and 3, so you know which layer you're looking at to note your findings. Starting with the lower portion of my sediment, I'm going to place it here on stage and observe it under 100 times first. Yes. Do you remember? Yeah, blood.
How are we doing today?
Fantastic. How are you?
Cannot complain.
She's like, wow, this is so great. She's been active. She was like, just under the clothes. She hasn't been there in a while. I was like, that's kind of actually.
Again, seeing normal fecal material. Possibly some grass artifact, but no fluke exorcist, which is what you're looking for at this level of fecal sedimentation. Moving on to the middle section of the fecal sedimentation.
Or the
Again, at 100 times power and 400 times power. Observing in a zigzag motion and doing a general scan over and then really thoroughly looking.
Yes. Where are you? Oh, wait, I suppose. Just a food for children.
yeah, we're gonna give this a couple of days and we're gonna see what the fecal shows.
Okay. What? Awesome. Okay. And you guys had this number 1. Oh my god. I don't know how long it's been there.
Yeah.
But I got it number 1. Hi. Actually, I know. I was gonna have like a cast and see if she can figure it because it's my stuff.
There's an 18 on there. They also have a 16. We don't want it for probably at least 10 to 14 days. If he wants to bigger back, fine. If he wants to 78, come back. It's on already. I'll call him with the fecal tomorrow. He's good to go.
No significant findings in the middle there either. Did see a leaf
Oh, really?
or grass, a blade of grass particle, and normal fecal material. So on to the last layer. This was a fecal sample that was collected immediately after it happened and then refrigerated until it was ready to be made up into these slides. So across the board, the fecal sedimentation is negative, but again, that's going to be more common for large animals because fluke ova like to sink. Hello, my name is Faith Jordan. Student ID is 3630837. And today I will be demonstrating how to perform an ear cytology for Clinical Pathology 2, fall semester 2024. We have many animals come in for a variety of reasons that require an ear cytology with symptoms like head shaking, scratching at the ears, redness, heat, odor, discharge. We see it in cats as well. We see it in a lot of allergy dogs as well. And so those would be a lot of clinical signs that we would want to collect an ear swab of either one or both ears, depending on the symptoms and the doctor, and evaluate that under a microscope. Sit, good boy. So this is Miller. I'm going to be showing you how to collect that sample. I have got 2 of my cotton tip applicators. And I want to be careful to not touch any other surfaces with these because it could interfere with the results with debris. So what you're going to do is you're going to hold this pinna up of whichever ear you're going to take a sample from. You're going to stick the cotton tip applicator in and just roll it around in there. And you want to go fairly deep, but you don't want to go too deep. Not something we recommend owners do at home, not something we recommend using cotton swabs for, but we like to go deep enough that when we come back out, we have a nice sample. So that was his left ear. I like to break my left. And we will do his right. Sit. Be a very good boy for this. And again, holding up that ear pinna. Face the camera. Face the camera, buddy. Okay. Holding up that ear pinna, applying it in there, and rolling around to get a fairly decent sample. Now, Miller is my dog. He does have allergies, and it is actually time to recheck an ear cytology for him because he does get a lot of infections. So now I will explain the processing part when it goes onto the microscope slide. Okay, so now that I have my samples, leaving my long one as the right ear and leaving my broken one as the left ear. I have my clean microscope slide, and what I'm going to do is I'm just going to roll them on there. Some people do left on left, right on right, or do a top and a bottom line. I like to do left on left, so we're wanting to roll to get all sides of the swab to get a complete sample. And then I will do the same with the right on the right. Rolling, swabbing, getting all the debris on all sides of this cotton tip applicator. Now you can choose to heat fix it. Some textbooks say not to, some do. The tricky part with heat fixing it, you don't want it directly over the flame. You hold heat too long, you can destroy some of the cells, dry out the sample. So for this purpose, I'm just gonna make sure it's really dry before I start to stain it. Okay, so now that my slide is dry, I have it on a clothespin, a wooden clothespin, labeling top. With a pencil, I've wrote Miller's name on here with the date of collection and time and just years. I think AU, that it's both years. So now what we're gonna do is we're going to be sure that when we're staining these, we go and use the ear/fecal one. We do not use the clean blood one. We want to keep those separate since blood is as sterile as can be. So first I'm going to put my stain in the methanol, which is the fixative. You can let it sit for, some people dip it for 10 seconds. Some textbooks say to let it sit for 30 seconds. I like to let it sit for 30 seconds and then move on to the E/Y and then to the methylene blue stain.
Does it say they have?
All right, moving to the E/Y. All right, and now moving to the methylene blue stain as the last one. And again, I'm just carefully letting the rest of whatever previous stain just drip off so I don't cross-contaminate a whole lot. Okay, so now that it is done staining, I'm going to take my distilled water in our separate container, pull it out, and because I marked the side top, I'm going to want to go to the back side of the slide and rinse it with that distilled water. Careful not to get it on the front so that I do not disrupt what we have just stained, and then I will carefully remove that pin clip. I'm going to use bibulous paper to dry it. You can let it air dry. So you stick it in. Let's go to another somewhat clean page. And repeat until it's completely dry, which now it is. Now that I have my slide on the microscope, I make myself a little note here with the patient's name, the date, and then left ear and right ear with my findings. We're going to be looking for waxy debris, epithelial cells, keratinocytes, yeast, bacteria, cocci, and then we're going to want to quantify those things. So rare to occasional, +1, +2, +3, +4, and then TNTC, which is too numerous to count. And so depending on what I see per high powered field, once I get to immersion oil, that's how I will classify those things. So starting on the lowest power, I will start at 40 times and work up to 100, then 400, and then to the immersion oil. Typically, some practices will ask that you also create a ear mite slide at the same time you're doing an ear cytology, just to check, make sure there's nothing, especially if the pet is indoor, outdoor only, not on prevention, things like that, or has a history of ear mites. But for this purpose, we're just doing this ear cytology. So now I will evaluate. And I'm starting on the left side. The other thing that you can see in an ear cytology, especially if there's bad scratching, white blood cells, and typically they're going to be streaming, which is going to be that they have been disturbed from the amount of irritation to that area or trauma from scratching. so now to the immersion oil. Just place, I like to go back this way because I'm hesitant that I scrape the slide on accident while trying to get it there. I like to have Kim wipes because not everybody cleans their lens afterwards, and I like to just wipe it off before I use it. And you're just going to use a small amount of immersion oil right about where the light is on the center. Okay, now we're going to move to immersion. Now this is where I'm going to start quantifying everything. Cocci are going to be little, very tiny circles that are all clustered together. Your yeast are typically going to look like bowling pins. They're going to be dark. They're going to be stained dark. Cocci come in a lot of clusters. And they're going to be a bit lighter, significantly smaller than yeast. And then rods. So rods are going to look like rods. Typically when you see them, you don't just see one or two, you see a lot of them. And for Miller's left ear, I am seeing rare yeast. I'm seeing 1 per high power field, and probably occasional cocci. There's only a couple clusters on here, and it depends on which high power field I'm looking in to seed them. So I would say occasional and rare yeast in that left ear. Okay, now for that right ear, I'm actually seeing rare yeast, rare cocci, a couple epithelial cells. Typically, we don't quantify those. We just inform the doctor that we're seeing them. If I were to quantify them, I would say +1 on that ear. Otherwise, I misspoke. Rare yeast, rare cocci. I'm seeing 1 per high power field. Sometimes it takes a couple high power fields for me to move to even see that cluster or that yeast. So rare for the right ear and occasional and rare in the left. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be demonstrating how to perform a skin scraping for ectoparasites for Clinical Pathology 2, fall semester 2024. Things that might indicate needing to do a skin scraping are patients that present for itching, not on prevention, and not just like allergy itching, but excessive itching. And they've done their course of steroids, and they've done their trial and error of Apoquel, Cytopoint, nothing's working. And so when you're doing a skin scraping, you want to get all those subcute cells to see, do we have major mites? So we're looking for Dodemadex or Sarcoptes to rule those out. And then additionally, is there yeast or bacteria on the skin? Do we have a skin yeast infection? That can be treated completely differently and manage the symptoms better if that's what we're seeing, because we should not be seeing that on the skin at all. So now we're going to prep. So I've got my microscope slide here. I have my mineral oil, and you use about a dime size amount on here first. Okay. And then your 10 blade. So you want to do this, you want to lather the blade in mineral oil, kind of dull it, because the goal is to effectively get a good skin sample, not necessarily, we're not cutting, we're not doing that. Both sides mixed. All right. When you are choosing a site to do a superficial skin scraping, you want to do a site that is going to be a high area where there's chances that you will see those mange mites where they like to hang out. So sometimes it's in the groin area, belly. You typically want to have if there's very furry, you want to shave that and get that out of the way. Remove any lotions or any topical ointments that they have on first so that you can get a pretty accurate sample. But you want to go for the areas that look like they're going to have the most uptake for that sample. So I have chosen the groin area here, And so what we're gonna do is we're going to pinch the area that we want to sample between our thumb and index finger here. So what I'm gonna wanna do is hold the blade pretty perpendicular to the skin and scrape against the grain of the fur. So again, I have this area pinched here and I'm coming towards me. You're gonna wanna do this until you see some blood from capillary vessels to be sure that you're getting a good superficial scraping. So now we have some blood from the capillary vessels. I'm going to take this and mix it on my slide. So now I'm going to take what I have scraped and mix it on my slide with the mineral oil to get that off. To look at it under the microscope at 10 times and 40 times objective. So that's 100 and 400. Now with this, I'm just mixing it in there. You want to cover kind of a broad area when you're scraping of the site that you specifically want, the sites around it. And then a lot of times, depending on what you're doing, you'll want to repeat in other sites and get separate slides for that. So you can see I've got a pretty decent sample amount here. And let's put it under the microscope and take a look. So the difference between superficial skin scrapings and deep skin scrapings essentially is going to be what you end up finding. So when you're doing deep, that's going to be more likely for you to bring up that Dodemodex. There is the canis version and feline version. When you're doing the sub-Q, you might find Sarcoptes, which is like scabies. So it doesn't take a whole lot to get deep with that, but if you're looking for other things like fungal infection, any form of skin infection, you're going to want to be deeper and a little bit more rough. You're going to want to do a lot more areas. You want to shave back any hairs so that you don't get any foreign material in that reading. I'm going to start out by looking at this at 100 times magnification, so 10 times, and then going up to 40. And like I had said earlier, if you're doing a deep skin scraping by squeezing those hair follicles and such, you're pushing up the Demodex, which is what you're looking for in that, versus a superficial, which would be scabies. So let's take a look and see what we find. Okay. So I'm actually seeing a couple yeasts, which is abnormal. You should not see any yeast or bacteria on the skin. I know I had stated earlier that my dog is an allergy dog, but he definitely could have something else going on here. All right, let's go. Let's go to 400 times. Let's see. So on the high power field, it's definitely a lot less than what I was looking at when on the 400 times versus the 10 times power. So in the 10 times, I'm seeing about like 4 per field. I'm seeing like 1 or 2 per field for the 400 times. So the skin scraping in regards to ectoparasites is negative. However, there are now some additional findings that I will need to make the doctor aware of. Hi, my name is Faith Jordan. Student ID is 3630837, and today I will be participating in a necropsy for clinical pathology 2024 fall semester. And a necropsy is a post-mortem exam that tremendously helps in diagnosing of many diseases and parasites that sometimes go missed. So a lot of times when we've done our lab work, radiographs, all of our tools that we have in clinic, and yet the pet still passes away, or sometimes they pass away unexpectedly. A lot of times we want answers. And so with the owner's permission, a doctor might perform a necropsy. And that would be to collect tissue samples, see if there are any damaged or dead tissues within certain organs. If there are internal parasites, there could be a lot more findings than just what we see with normal diagnostics, and even cultures that we would send out to a lab. So a necropsy can be very helpful in giving owners peace of mind as to why the patient may have passed, and also giving us some answers. And then, of course, before we do that, the doctor will do her external exam, and then go over those findings as well as internal. A lot of times what we do is we collect biopsy samples of specific tissues that the doctor might find to be necrotic, or tissues of organs that may appear infected, and obtain those samples to send out to a outside lab for pathologist review, and see if that gives us a better definition of what the cause of death could have been, if there was a new underlying disease that we were unaware of, and get those answers. Depending on the animal and what their exposure is to certain indoor-outdoor elements that you are doing this necropsy on, some of the tissues of the internal organs and even exterior can have lesions due to parasites. So that could be immature parasites or adult parasites. And typically we think of parasites in a daily setting of whether or not they're in the feces, GI tract, or in the blood, like heartworm or microfilaria. And so what this does, it gives us a closer look at other things that we may not have thought to think about, nor could we have really gotten a great sample until doing this procedure. Here with Dr. Benarski to do the necropsy on Mr. Cuddles the rat. What we're going to be using today is our needle drivers for our suture at the end. We're going to use our forceps, medicine ball scissors, and then our scalpel handle and our scalpel blade. And I've got Mr. Cuddles here in dorsal recumbency with his forelimbs taped down to the pod.
All right, on external exam, don't see any wounds. I don't see any bruisings. He doesn't have any angular limb deformities or fractures. I'm not seeing really too much on his external exam for the cause of death. We're gonna start with our midline incision. We've got our heart, we've got our lungs. This was our diaphragm that we separated to look through everything. Liver looks pretty normal. I don't see too many issues with the liver. Has normal texture and color. Here's the stomach, also feels and palpates and looks normal. Spleen right here, don't see any lesions on either side of the spleen. Got one kidney over here that also externally looks normal. Don't see or feel any lesions. Consistent color. Move the GI tract over. Find our other kidney that looks pretty normal as well externally. Through the GI tract, looks like we've got our cecum, our large intestine, small intestine just running through here. Don't see any obvious abnormalities. It's pretty empty. Mesentery looks normal, no abnormal color. So far, all of his internal organs look normal.
All right, so Dr. Benarski is going to do a biopsy sample of the liver. Here on this formalin jar, I have the date that we are collecting it, Mr. Cuddles' name and his last name, his internal identifier for our system, the doctor's name, and the sample that we're obtaining from. And then once this is all packaged and ready to go, I will have to print a requisition sheet that will go, we will keep one end, and then the lab will get the other one with the specific biopsy order that the doctor wants. All right, and the second biopsy that Dr. Benarski would like is of the spleen. Again, I have the date that we collected that on, Mr. Cuddles' name with the last name, his internal identifier in our system, doctor's name, and that we are collecting the spleen.